Hello, everyone, and welcome back to Black Mental Health Matters. I'm Dr. Carrie Ann Williams. I'm a psychiatrist practicing here in Massachusetts, and this is a show that's about everything related to mental wellness in the Black community and beyond. So, in a previous episode, I kind of spoke about the fact that I wanted to have a podcast episode that was pretty much dedicated to talking about what to expect when you go to see the psychiatrist. Last week, I spoke a little bit about what to expect with an anxiety screening. And I said, that's just the anxiety screening portion. That's just because a new recommendation came out about the fact that anxiety screenings are required for or recommended for everyone at this point. But today I want to talk a little bit about what to expect when you go to the psychiatrist appointment. And this is because, the entire time that I've had first my radio show and now this podcast, I've said to you, you should go to see a psychiatrist if you feel like you need to. You never know unless you go. And in the Black community in particular, there is definitely kind of more of a reluctance to see a psychiatrist for a lot of reasons. But one is, of course, that stigma associated with psychiatry. And if you think about it in general, people tend to go to the doctor if they feel like they have a problem that they can't manage on their own. So for physical health, that might mean now the pain is unbearable and I can't manage the pain on my own. Now the mobility issues are starting to get in the way and I really should get that checked out. Now I'm having trouble breathing, you know? Um, and sometimes if there's an issue that you can't immediately feel, like for example, people that are trying to manage diabetes and they might not feel right away that their blood sugar is a bit too high. Sometimes they don't actually go to the doctor as often as they should to get that tight management of their medical health. Well, in psychiatry, there is even this kind of greater meaning to the idea of when I can't manage it on my own. And a lot of people, that sense of when I can't manage it on my own has a totally different threshold. So in general medicine, we have this idea of preventative medicine. You can go for, annual checkups and the doctor will check to see whether there's anything small that they can kind of catch early and prevent from happening. Or if you have certain conditions and you go for your check-ins regularly, then you can keep small issues small as best as possible. There's not really a culture of preventative psychiatry, if you want to think about it that way. So the idea of like catching things when they're still small so that they don't get bigger, that kind of hasn't really caught on too much in psychiatry, and particularly in the Black community. If you have a small issue, it's much less likely that you're going to go see a psychiatrist for something small. And I don't want to go too much on a tangent, but there sometimes it's this thought in our culture in general that your thoughts, emotions, and behaviors are 100% under your control. And therefore, if you admit that you need help with any of these things, kind of makes you a bit of a secondary citizen that you can't, manage it yourself. People take a lot of pride in being able to say, I did this myself. I'm able to kind of do this on my own. And again, not trying to get on a tangent, but like from an entertainment standpoint, mental health representation on TV is a little bit kind of a part of the problem as well. Because if you think about it, run of the mill mental health issues, kind of routine, mundane mental health issues would make very boring TV. Someone that's just being treated for mild depression, boring TV. So, in order to make things more interesting and more entertaining, mental health is generally represented as kind of more severe and very unpredictable. And that keeps the audiences engaged. But people kind of walk away from those experiences thinking, well, I'm not at that level. So I don't think I need to see a psychiatrist. Psychiatrist is for people, it's for people like those people that were on TV or in that movie. And so people can really get a lot of their impressions about what psychiatry is and what it means from what they see on TV or in movies. And for audiences, we can really underestimate how much TV imprints the examples that we have of how the world works in general. And so in the absence of any conflicting information, we really only have the images of what we've seen on TV of what mental health is and what it means. And the truth about mental health is actually much less interesting. And so I'm here to tell you today the truth of what to expect when you go to see the psychiatrist. Now, your first experience with a psychiatrist is going to depend on why you're seeing them. There are a lot of different settings in which you can encounter a psychiatrist. So, the most obvious one is the outpatient clinic. In that scenario, someone may have referred you to see the psychiatrist, or maybe you initiated the call yourself to see the psychiatrist. Sometimes people encounter a psychiatrist for the first time in a medical hospital. And so they're there, they're on the floor, they're admitted to a medical hospital, and their team calls for a psychiatry consult. And then there's kind of this intersection between psychiatry and the medical condition that they came for. And sometimes that's the first time they've seen a psychiatrist and had an assessment. They'll meet you right there in your hospital room. You may be in the emergency room, and the emergency room team calls for a psychiatrist to meet you. And in that setting, it may feel a bit more like a crisis situation. Okay, there might be a bit more pressure, a different kind of atmosphere. For some teens, for adolescents, there may be a clinic located in their school, and that's called school-based mental health. So they may see a psychiatrist for the first time at school. Sometimes a person who's recovering from an addiction may get admitted to a recovery facility of some kind, and they may see a psychiatrist for the first time in such a facility. So there's a lot of different scenarios where you may encounter a psychiatrist. And the appointment often kind of starts out the way that you might expect. The same way that a medical appointment might start off. It's like, start with basic information about yourself. So you may fill out on a form this information, this demographic information they may be looking for, or they may ask you about it at the beginning of the appointment. Some psychiatrists will send questionnaires ahead of time of the kind of ahead of the appointment, and they ask you, can you please fill out these questionnaires by the time that you arrive for your appointment? Some people will give you the questionnaire when you arrive for the appointment instead of sending it ahead of time. And then some people are kind of a bit more like me, where I don't necessarily send people the questionnaires, but I will ask them the questions that are on the questionnaire during the appointment and make it a little bit more conversational. So those questionnaires are basically screening tools that help us to kind of get more information and just helps us with our assessment of what's going on for you, helps to make things a bit more comprehensive. So after some of that basic information, we'll include asking you why you're there. What brought you in for the appointment? So that's a question you can expect. You may have chosen to come to the appointment just based on your own decision, or you may have been recommended by another provider to come to the appointment. Some people are court ordered to attend psychiatry appointments. And as you can imagine, that kind of situation can influence the atmosphere of the appointment, because a court order kind of changes the voluntary nature of the appointment and assumes that there are some implications for the result of the assessment. So today, I'm not going to focus on the involuntary psychiatry appointments. I'm just going to focus on voluntary psychiatry appointments. So as I mentioned, you come in, we ask you, what brings you in today? And then you begin the discussion of your story. So in your story in particular, we want to know what you're concerned about, how long that concern has been going on, what was the circumstance under which the issue began. Are there times where the issue isn't as much of a problem? Are there times when it improves? And if so, what helps? Are there times where the issue worsens? And if so, what makes it worse? And I always like to know, why now? Why are you seeking a psychiatry appointment now? Or why are you being referred for psychiatry now? I want to know about the timing. And I know, understandably, some people have actually been, waiting for months for psychiatry appointments. So by the time they come in to see you, that's not actually the time that they really were concerned. So I want to know more about the time that you initiated the the kind of seeking psychiatry, not necessarily the time that you got the appointment, which can be delayed. So we establish why you're there and what your background story is. And from there, we begin our follow-up from the items that you discussed. For example, we may start off with kind of following up with a specific line of questions that assess the particular issue that you brought up. For example, if you said, the reason I'm here is because I've been feeling a little bit depressed, then we may follow up with specific questions that assess for depression. But in addition, we're going to ask about questions that are unrelated to the issue that you brought up. And that is what makes the assessment more comprehensive. So it's going to address the issue you brought up, but we'll also cover several other areas that a physician like myself who practices psychiatric medicine needs to know about to kind of make that decision about what's going on and what to do about it. So let me kind of give you the rundown of the psychiatry assessments, just so you have a sense of here's what do I need to do to kind of get myself prepared to go in. And also just to demystify it a little bit. I don't want you to feel like this is something that's kind of strange. It's really intuitive in many ways. We start off by reviewing the different areas that are related to your thoughts, feelings, and behaviors. And we call that our psychiatric review of systems. And it's just because we're reviewing all the different kind of aspects of thoughts, feelings, and behaviors. And I'm going to break that down a little bit towards the end of this episode. The other thing we're going to ask about are physical health questions. I want to know what else you have going on. Do you have asthma? Do you have heart problems? It's important for me as a physician to know your medical status. Then I want to know if you already take medications for any reason. If you take medications for physical health problems, if you already take medications for psychiatric reasons, and if you've ever taken other psychiatric medications in the past. So I want to know all your medications that you currently take and the doses. So if you come to the appointment, I want you to bring that information with you to the appointment because we're going to need to know your meds and your doses. We also need to know if you're allergic to anything, especially if you're allergic to any medications. Then we want to know your family history of both medical health issues and mental health conditions. You may be surprised at just how much can be inherited genetically that is related to mental health. So we want to know if there are other people in your family that have had depression, anxiety, ADHD, all these sorts of things. So we're going to ask, so maybe in preparation for your appointment, you can kind of find some of that information out because it may help you in your appointment, helps us with our assessment. We also want to know about your use of alcohol, nicotine, cannabis, and other drugs. And this is not for the purposes of judgment or to be preachy about just stop it. We're not going to be preachy like that. But we're physicians, and all of these things have medical effects on the body, and they sometimes interact with medications that you're taking, and you may not even realize it. Sometimes the things you put in your body, like alcohol, cannabis, they may increase your risk for certain psychiatric conditions. And even though you might not want to hear that, there have been many times that we can trace back the start of a psychiatric condition to the use of a substance like alcohol, cannabis, or other drug. And so for us, by knowing what's truly causing an issue, it saves us from recommending some kind of incorrect treatment or some kind of useless treatment because we're mistaken about what the cause of an issue is. We also ask about other things related to your life and your family. So we're going to ask about your occupation. We'll ask about your family composition, whether you're married, unmarried, used to be married. We're going to ask about your kids. How many kids do you have? What's the situation? We'll ask about your own childhood experiences, your kind of experiences growing up. We'll ask about whether you've been in the military. We'll ask about your legal history, whether you have any charges or other history of legal involvement. And sometimes we even ask about educational history. Again, depending on what we're assessing, we might want to know if you have a history of learning problems, that sort of thing. Now, sometimes when we get to this part of the interview where we're gathering all this background information, people kind of pause and begin to question, why do you need to know all of that? Why does a psychiatrist need to know all this personal information about me? And that, of course, that kind of communicates a little bit of mistrust. So, I mean, at first, I guess I'd pause and say, if you don't trust the psychiatrist that you're meeting with, you should find a psychiatrist that you trust. So that's one, is that you really need to kind of be working with someone that you can trust when they ask you questions, that their intentions are good. But also, there's a temptation, I think, especially when there's an air of mistrust, that sometimes the client or the patient, when they come for appointments, they are trying to choose for the psychiatrist what information they think you need to know. And I would caution against that kind of editing, because you may not realize why a psychiatrist is asking a particular question. And again, sometimes if we don't have all the information we need, we end up recommending the wrong things, or we end up recommending a useless treatment because we've completely missed what might be really related to the issue that you've brought in. So try not to completely anticipate what the psychiatrist needs to know or doesn't need to know. And if there's a question, do your best to answer it honestly. There's a purpose to all the questions that are asked. There's a method to the madness. And just like if you had any other, professional that was working with you, if I hire a plumber to come and fix a problem in my house, I'm not going to stand over them and say, hey, why are you doing that? Why are you doing that? And like every 5 minutes, ask them, why are they doing something? At some point, they would just say, hey, just kind of let me do my job. I think at some point you do have to let go and trust the psychiatrist asking you all these questions. I mean, you can ask questions. Please feel free to ask questions, but just know that there's a method to the madness, and we're not asking it to be intrusive. We're asking it to do a comprehensive assessment. And again, in your ordinary life, you may not be telling other people these very kind of deep or personal issues, but the psychiatrist, if there's anyone that you can tell personal issues to, it would be your psychiatrist. We're bound by confidentiality, which actually I didn't mention, but at the beginning of the appointment, often the psychiatrist will explain the limits of confidentiality to you, and explain that the things you tell them are confidential unless they're safety related. And then the only way a psychiatrist can breach confidentiality is if you're planning to hurt yourself or you're planning to hurt someone else. Then they may have to intervene for the sake of safety. But everything else is confidential. So, in psychiatry, there are many factors that contributes to a person's psychological health. I guess I'll just give you a quick explanation for why I ask those questions. A lot of things contribute to a person's psychological health: work, stress, family or childhood, physical health, medications, genetics, whether or not you've had trouble with the law, things that you saw during your military service. All of these things, I have to put them all together, and it helps me to determine the right treatment recommendations. So just wanted to explain, that's why we ask what may be perceived as somewhat intrusive questions about your life and family, or it may seem unrelated to the reason that you came in, but we will ask because it's important for us to get this comprehensive picture of who you are so that we can best help you. Okay, other things we ask about safety, as I mentioned before, but in addition, we ask about domestic violence, and we do ask about firearms. And again, whether we ask about it personally or you may be in a clinic setting where it's been asked on a form somewhere, that's generally, we like to ask about safety. Lastly, there are 3 more things that a psychiatrist, they don't always ask about, but they should. So, one thing that psychiatrists doesn't always ask about, but they should, they're supposed to, is religious beliefs and the role of spirituality. The reason is because it was determined through research, because research is a language that physicians love to listen to, that for many people, their spiritual beliefs played a large role in their mental health. The spiritual beliefs played a large role in their mental health, and psychiatrists were really missing this. They weren't asking about it. So they'd ask about all these other things. They'd make treatment recommendations, but they wouldn't really take into consideration that a person's spiritual belief really played a large role in their psychological health. Sometimes it is that their spiritual belief may play a role in their healing and recovery. And other times it may be that they may have a belief, or maybe some kind of spiritual crisis that could be actually causing a worsening of their psychological health. And so by inquiring about their spiritual beliefs, they can help to add that to the assessment. The second thing that psychiatrists should be asking about, but they don't always ask about, is your cultural values. Your cultural values. So psychiatrists are getting better about asking your cultural identity. They'll ask you about your cultural background. So we're really good at saying, hey, this is a such and such year-old person and they're of this background. And then they kind of move on. So they're great about asking about cultural identity. But cultural values is something that is really pertinent. And for those of us in the Black community, we know that our cultural values affect the way that we perceive our mental health. It affects the way that we accept or don't accept psychiatric assessments, our willingness to engage in treatment, the meaning that we make out of taking medications. There's just such a huge overlap with cultural values and mental health. And again, psychiatrists had been missing this. So they technically should be asking you about your cultural values and not just your cultural identity. And then the third thing that psychiatrists sometimes miss, but they should be asking about, are your strengths, your personal strengths, your interests, your hobbies, which might seem like such a small thing, but psychiatrists, just like, other physicians, can get really focused on assessing for illness and sometimes miss out on asking about the things that are going well, the things that are good, the things you're good at, the things that make you a whole person. So that's kind of my rundown on the psychiatric interview. There's one more thing actually. And this one kind of depends on the reason that you're seeing a psychiatrist and your age, but you may get what we call a mini mental status exam. And it's a brief exam. It kind of really varies. Sometimes it's as brief as asking someone if they're oriented to the day of the week or the time of day or something like that. And anybody can be asked that question. Sometimes it involves asking a person to memorize something or to spell something backwards. Some folks are asked to draw a clock. And these are going to be selected based on the reason that you're there, as well as your age and other factors. So not everyone necessarily is asked the same things, but just so you can know to expect that when you go to a psychiatrist appointment, they may ask you this kind of these additional questions to, again, assess your mental status. So that's a nutshell of the psychiatry appointment. And I did tell you at the beginning of it that I was going to go back and break down what I call the psychiatry review of systems. So it's one of the first things we ask about. You come in, why are you here? You tell us your story, and then we start asking some follow-up questions. The follow-up questions, some of them are going to be related to the reason you came in, and some of them are just going to be part of our comprehensive assessment. So this is those review of systems, if you want to call them systems. And so we screen for depression, whether or not you came in with a complaint of depression. We're always going to screen for depression. And we're always going to screen for suicide risk. So whether or not you've had a history of suicidal thoughts, a history of suicide attempts, whether you're currently having thoughts of suicide, we will screen for suicide. We're going to ask about your sleep patterns, your appetite, your irritability or anger, your interest in life or lack thereof. We're going to ask about energy and fatigue. We screen everybody for something called bipolar disorder. Everybody gets a screen for that. We're going to ask questions related to it. Also, in the safety and risk category, we ask about a history of self-injury. And for those of you that are listening that are unfamiliar with the idea of self-injury, it's more common than you think it is. And so we routinely, as psychiatrists, ask about it. If your answer is no, it's no. And if it's yes, right? We ask about serious thoughts to harm another person, including whether or not someone has had thoughts to kill another person. So we do routinely screen for violence risk. Again, If thoughts to hurt another person just seem so far away from who you are or your general nature, and a psychiatrist asks you about it, it's not an accusatory question. It's just an obligatory and routine screen for violence. That's part of our job. That's part of what we're supposed to do. Again, whether or not it's related to your reason for coming in, we're going to ask you about a history of hearing voices or seeing images that other people can't see or hear. Another obligatory and routine question that you should answer honestly, because we really are very sophisticated in the way that we think through people's experiences, and we're not really quick to give people labels. So if your answer is yes to hearing voices or seeing things, please be honest about that. At least I'm not quick to give people labels. There's a lot of reasons that people might experience that. So it's important to be honest and to kind of give the psychiatrist the information they need to kind of accurately talk to you about what you're experiencing. We always screen for anxiety. I spoke about that in the last episode, so I'm not going to really talk about too much about that, but there's general anxiety, social anxiety, panic attacks, phobias, obsessive compulsive disorder, which, by the way, is underdiagnosed in Black people because the symptoms often get attributed to other diagnoses. And in children, we screen for issues related to, that are kind of first diagnosed in childhood. So for example, ADHD tends to be first diagnosed in childhood. So we screen for ADHD. We screen for like severe issues with defiance. We screen for conduct issues, eating disorders, autism tends to be diagnosed in childhood. We screen for those things. So that's kind of your psychiatric assessment. And so I want you to just kind of think about that and think, that didn't seem too bad. We're just asking you questions. We're asking you questions about your life. We're asking you questions about your emotions, your thoughts, your behaviors, your safety. Those are all questions that you have the ability to answer, and hopefully you'd feel comfortable talking to a professional about that. And then what do we do after this is all over? What do we do at the end of this, right? So depends on your particular physician that you've seen, the psychiatrist you've seen, depends on your reason for being there. Again, depends on whether you're seen in a clinic, you're seen in a hospital, you're seen in an ER. All these things will determine what happens next. Many of us try to avoid prescribing medication at the end of the first appointment. But again, sometimes depending on the setting. So let's say, for example, if you're in a hospital and we have all the information we need, we might be able to make a recommendation for a medication at the end of the first appointment. But more often than not, we try to give it a little bit more time. So one outcome could be a medication recommendation, but another outcome could be a recommendation for individual therapy. And then another outcome could be related to getting you set up with other services that you might need to support you. So for example, children with Medicaid may qualify for in-home services, a therapeutic mentor or case management. So you might just follow up with additional services depending on who you are and what the situation is. The other thing I didn't mention, which I kind of thought of, is that in the last several years, many psychiatrists have been encouraged to also screen for food insecurity. So you may be asked about food security at home, and we can help you get set up with the services that you may need to be able to have regular meals, if that's something that has been an issue. So there's a lot of things that can happen at psychiatry appointments, depending on the setting in which you see them. Psychiatrists aren't just there to kind of label you or pigeonhole you. We really are there to help. And there's a lot of ways in which the field has evolved to just to help serve people, just to help serve the needs of what people might have. So I think I'll end there. What did I miss? What did I miss? If those of you listening have been to a psychiatry appointment and you think I missed something that you got asked about, please let me know. I'm on social media. I'm on Instagram and Facebook at Dr. Carrie Ann, and I'm on Twitter at Dr. Carrie_Ann. Don't forget to leave a review of this podcast if you enjoy listening to it. Take care and have a great week.